Here is the only weight loss technique that actually works. It's intermittent fasting. I'm Dr. Barrett, I'm a plastic surgeon. I do a lot of body procedures and sometimes patients have a hard time getting to their goal weight. I've been through everything: keto diets, intermittent fasting, calorie counting, strange, excessive kind of workouts. The one thing that always works for my patients is intermittent fasting. Here are some tips and tricks to make it work for you. Number one, stay consistent. Whether you're going to do 16 hours of fasting and 8 hours of eating window or whatever it might be, stick to the same time so your body gets used to that rhythm, at least at the very beginning, so that it's not such a hard transition. Number two, don't worry about anything else except the time at which you eat. Don't worry about the food that you're eating, any other thing to make it even harder, like caffeine and all this other stuff. Just focus on one thing at a time. It's kind of like a golf swing, all right? So if you try to change too much with your diet or your exercise and everything else, you're just gonna say screw it and give up. Number three, once you get used to whatever pattern that you want to do, start to add some variety to it. Okay, so some people do the 16-8 for 5 days a week, then 1 day of complete fasting, and then 1 day of feasting. You want to experiment how your body handles the different time frame of when you actually do start to eat. Some people argue that they should do it earlier in the day versus later in the day because your sleep is actually beneficial if you've had enough time to digest the food in your body. And then you can actually switch it up a little bit. Some people do 1 meal a day, and they have results with that. It also depends on your activity level. So start to add variety. Once you get used to the basics, then you can start adding variety to keep your body in motion.